Hey guys, this is Dr. Jasmine coming at you with yet another video. It's January 31st, 2022. I can't believe that we're already finishing the month of January and moving on to February. Today I'm going to talk to you about Sotrovimab, which is a monoclonal antibody. So just starting off with some quick background information. As I mentioned, it is an engineered monoclonal antibody, and it neutralizes the virus by binding to a protein that lies outside of the receptor binding domain. So just a quick refresher, the COVID virus has these little spikes that protrude off of the surface, and on those spike proteins is something called a receptor binding domain, which it uses to bind to our ACE2 receptors and infect our cells. So this monoclonal antibody actually binds to a protein on the or outside of the receptor binding domain. And it's this protein, actually, that remains unaffected as the virus mutates. So as the virus changes, this protein stays the same. It doesn't change. The original form of Sotrovimab I thought was really interesting. It was isolated from a patient with the original SARS, so SARS-CoV-1. It's authorized for use in non-hospitalized mild to moderate COVID-19 in adults and in pediatric patients aged 12 or older who are at risk for severe COVID-19 disease. So it's not currently approved for hospitalized patients. It's not approved for those requiring oxygen or an increase in baseline oxygen requirements. And as I stated earlier, it is effective against Omicron. So risk factors for severe disease include age greater than 65, obesity, pregnancy, chronic kidney disease, diabetes, immunosuppressive diseases like cancer and transplants, for example, bone marrow transplants, or treatment with medications like Humira, Enbrel, and Remicade, cardiovascular disease or hypertension, chronic lung disease like COPD, for example, or emphysema, sickle cell disease, and neurodevelopmental disorders. So the dose is 500 milligrams IV over 30 minutes. Patients are monitored during and after the infusion for 1 hour, and it should be given as soon as possible and within 10 days of symptoms, and that's because that's when the viral replication is occurring. As a reminder, Paxlovid should be given within 5 days. So the data behind the use of Sotrovimab involved a phase 3 multi-center, meaning that it was done at various hospitals in different countries, randomized, double-blind, meaning that the study coordinators and the patients did not know what drug they were getting, placebo-controlled trial. There were a total of 583 patients who were randomized, and it took place between August 7th, 2020 through March 4th, 2021 at 37 sites in 4 countries, including the US. And they looked at a single dose of Sotrovimab versus placebo. They included patients who were at high risk for progression of COVID-19, and patients were excluded if they already had severe COVID-19, had oxygen saturations below 94%, or required supplemental oxygen. So this table here actually looks at the baseline demographic and disease characteristics in the patients who got Sotrovimab and those that got placebo. And what I thought was interesting was that actually a fair amount of patients were included who were Hispanic, 66% in the Sotrovimab group and 61% in the placebo group, for a total of 63%. And I think that's important to acknowledge because we do know that African Americans and Hispanics have been disproportionately affected by this pandemic. So it was nice to see that they did make up a large percentage of the study population. So now on to the meat of the study, the results, what we're all waiting for. So 85% reduction in hospitalization or death was seen in patients given Sotrovimab versus placebo, and none of the patients in the Sotrovimab group required ICU stay. So this is a table that I put together because I think it's important to highlight the differences between the two medications. For Sotrovimab, the dose is 500 milligrams IV times 1, which makes it very nice. Paxlovid, as you recall, has 2 different medications, 3 tablets twice a day for 5 days. For Sotrovimab, it has to be given within 10 days of symptom onset, and for Paxlovid, it's within 5 days of symptom onset. As we mentioned, Sotrovimab is a monoclonal antibody that prevents the spike protein from binding to our cells, and Paxlovid blocks the production of viral proteins. In terms of pregnancy, lactation, fertility, there's limited data, but generally considered to be safe with Sotrovimab. And then just remember that the ritonavir in Paxlovid can reduce the effectiveness of hormonal contraceptives. In terms of drug-drug interactions, there are none for Sotrovimab. The ritonavir is a potent inhibitor of an enzyme called CYP3A4, which is produced by the liver. So you get lots of drug interactions. Specifically, one that comes to mind would be the statins. These are medications that lower cholesterol. So always make sure that your physician or your provider is making sure that there aren't any drug interactions. In terms of kidney disease, there's no adjustment for Sotrovimab, and it's not recommended in severe disease for Paxlovid. And with liver disease, there's no adjustment for Sotrovimab, and for Paxlovid, it's not recommended in severe disease. Well, I hope you enjoyed the video. I think the biggest issue that we're facing is that these drugs can be difficult to come by. But I think it's important to know the difference between the two medications. And if you are in that high risk category where you are at risk for severe disease, as soon as you are diagnosed with COVID-19, definitely reach out to your provider and they can try to get you one of these medications. Thank you so much, and I hope you enjoyed watching this video. Stay safe out there, and I will see you next week.